You're live, sir.
Hello, Santa Fe. Mayor Alan Weber here from the mayor's office this afternoon. Happy Friday, everybody. Have a great week, I hope, and a great weekend ahead. We usually start with COVID. Let's start with COVID and some data. As of today, residents in Santa Fe County with at least one shot, 57%. 57% of us have at least one shot. 37% of us are fully vaccinated, and 68% of us have registered with the Department of Health. So what that tells me is if you get registered, you get vaccinated right now. Please do get registered. DOH is able to work with a phone call, with a computer, whatever works for you. They have opened up the gates wide to let anybody 16 and over register. We really want to get everybody both registered and then vaccinated. To the credit of our friends at Christus and the county, the city, the National Guard, we are now doing community vaccinations at Midtown. I was there last Friday. There was one yesterday. There's one today. There are about 10 more coming our way. They're balancing out community response. They want to know what times of day or week, whether weekends are better than end of week. The whole goal is to get vaccinated as quickly and effectively as possible. In the meantime, I still wear my mask every time I go out. I still keep my hand sanitizer in my car so that when I get in and out of the car, a little squirt keeps my hands from ever being a source of an issue. I'm very mindful of staying 6 feet apart, being socially distant. And at the same time, Francis and I are starting to have a little fun, go out to dinner and enjoy Santa Fe. It's beautiful. It's a little windy, but it's beautiful. And so if you get vaccinated and get safe, we'll all be able to get out. There's more curbside dining if you're more comfortable outside. But remember, these are our local merchants, our local restaurants. If you're safe, they're safe. We want to be safe and open together. That's the Santa Fe promise. One other quick run of data. Going back over last weekend, a 3-day run of new cases was 17 over a 3-day period. So that's about 6 a day. The next day was 4. We ballooned up to 14 new cases, back down yesterday to 9. And you'll hear from Dr. Johnson what she thinks about with regard to the new cases and how to track them, but mostly how to stay safe, what we do to prevent the spread, and then finally get to the point where beyond 57% with 1, we get up to 60, 70% with 2. We're really setting the pace for the country. So with that, I will turn it over to my regular Friday afternoon partner in talking about all things COVID, Dr. Wendy Johnson from La Familia. Dr. Johnson, what are you seeing?
Hello?
What are you thinking about? What do we need to, you and I regularly talk about vaccine equity. I know you're always concerned that folks in certain zip codes get access to vaccine, but now vaccine hesitancy. We may have gotten the first group vaccinated. How do we get the folks who are a little more hesitant vaccinated? So over to you.
Yeah. Well, first I want to just talk about a little bit, because we've been getting a lot of calls at the clinic, and I know there's a lot of concern about the news that came out this week about the Johnson & Johnson vaccine. So to put this in context, the FDA and the CDC recommended that everybody stop giving the Johnson & Johnson vaccine until they could fully investigate a situation around some very specific kinds of blood clots, not all blood clots, but some serious blood clots that are that happen in the brain, in the cerebral venous sinus, it's called. And along with low platelets, this syndrome is something that can happen in a lot of different conditions. People who take birth control, people who are pregnant, people who smoke, people who go on long car trips or long plane trips. All of those can predispose you to blood clots like these. And even the COVID disease actually really increases your rate of possibly getting blood clots. So no matter what we learn about the vaccine, we know that the risk of the vaccine is still very much lower than your risk of having serious consequences if you get the COVID disease. And your risk of getting the COVID vaccine disease is eliminated. Severe disease is almost eliminated with any of the vaccines. So the rate that they're looking at, that they detected, was about 1 in a million. And so very low rate, much higher rate of blood clots and all those other conditions I mentioned. But they decided to stop the vaccines until they could see if it's one of 3 situations. One situation is this is an increased rates of blood clots for everybody who gets the Johnson & Johnson vaccine. So they might say, we're just not going to give the Johnson & Johnson anymore. They might say certain people are predisposed to these kinds of blood clots. So we'll say Johnson & Johnson is good only for certain people, but not for others. Or the third possibility is maybe they'll discover through this investigation, there really is no correlation, that this rate of getting blood clots that they saw amongst the people who got the Johnson & Johnson vaccine is pretty much the same as the kind of background rate in the population. Or that those people had another reason why they got the blood clots. So that's what they're doing. They're investigating this very thoroughly, and they meant to do it to indicate to the public that they're keeping a very watchful eye on any adverse events, and they're on top of it. If something, even is there a hint of something happening? However, unfortunately, they meant to do it to reassure people. However, a lot of people kind of took it the wrong way and decided, this is kind of related to the blood clots, and I'm just not going to get any vaccine. So unfortunately, that's what happens. People kind of hear part of the message and not necessarily the whole message, and get afraid. And as you were saying, we did the first million here in New Mexico. Those were the people who were really enthusiastic about the vaccine, who are interested in it. Now, the second million that we have to do are the people who have questions, who are questioning, who have a little bit more concerns or fears, or maybe they have some kind of underlying condition that they're wondering, I already, I'm on birth control, so maybe I shouldn't get a vaccine because maybe that'll make my rate really go up of blood clots or risk. And so there's a lot of unanswered questions. However, we're not giving Johnson & Johnson right now. The people who have already gotten Johnson & Johnson, the period of time where you have to worry about these symptoms is just 3 weeks. So if you got Johnson & Johnson more than 3 weeks ago, you're totally fine. If you got Johnson & Johnson within the last 3 weeks and you get leg pain or a headache that's unusual, or shortness of breath or any unusual symptom, you should definitely call your primary care doctor, or, go to urgent care if it's very serious, or go to the emergency room if it's, if you're having very serious symptoms. But if you got it more than 3 weeks ago, you're out of the woods. So don't worry about this whole correlation in that case. People who are thinking about the vaccine, the ones that we're giving now, the ones that are being given in the Department of Health, if you sign up, the ones that we're giving at Christus and at La Familia are the mRNA vaccines, either the Moderna or the Pfizer vaccine. And they're among the safest vaccines that we have of all the vaccines we have, including the flu shot, including the tetanus shot. And the safety profile, now we've given over 150 million vaccines across the world of these vaccines. The rate of serious adverse events is 0.005%. I saw a really good graphic in the LA Times where they had all these boxes. Each box was 15,000 doses, and the whole screen was filled with these little gray boxes. And one tiny box in one corner, a half of it, was red, and that was the amount of adverse events. And so, most of those adverse events are anaphylaxis. And, so far there really haven't been any deaths attributed to the vaccines. It's these kinds of things like like anaphylactic shock, which we can easily treat. And that's why we have people who are at risk for that wait for 30 minutes after getting a vaccine. So they're extremely safe at vaccines. They're extremely effective. And I think they're really the reason why we're still doing pretty well in Santa Fe, even though our restaurants are full again. And, we're starting to get back to live music again. Indian market's going to happen. We just got that announcement. So we're really getting back to normal. I know people are very excited about going out and getting out there. And I see a lot of people out when I'm going out. So, we still want to, if you're unvaccinated, still try to be safe, but that's a great reason to go get vaccinated so that you can participate in this great summer that we're going to have after we get through this windy season. We're going to have a great summer, and you want to be part of it. You want to be out and about. You don't want to be afraid when you're out with your friends. So, put your mind at ease and get the vaccine so we can all be safe.
And keep wearing the mask. I know I was driving around town yesterday, stopped in a couple of places to just check out what's going on, a hotel, a restaurant. People are here from out of town. There's a lot of folks who have been waiting and waiting and waiting to get out of their home to come visit how beautiful Santa Fe is. So I'm seeing license plates, not just Texas and Colorado, but back east in California and Oregon. And as they come here, we need to set a good example. We need to continue to remind everybody that we're a mask-wearing community. We are a safety-first community. And at the same time, the plaza was jumping, the restaurants were happening. The bowling alley over at De Vargas is open for business. Meow Wolf was scheduling folks to come through. The backyard over at the Children's Museum was open for business. Again, you have to schedule. We're still in a period of time where we're cautious, we're safe, we're trying to maintain some order and discipline while we enjoy an opening up. So you're absolutely right about the spirit that's out there. People want to get out, use the trails, use the parks, have a little fun, but stay safe while we do it. Any other macro trends you're seeing? Are we checking in on the variants headed our way? That to me is the biggest wild card. If we get hit with a variant the way some other states have, we could be back in a very serious place, because apparently they're hitting younger kids. They have a greater ease of being passed along. Some of them are even more virulent, more dangerous. That's another reason to take precautions, because there are still some serious variants out there to try not to let get into our community.
Right. I mean, I'll say a couple of things about the variants. First of all, so far, we don't see a lot of evidence of some of these dangerous variants in New Mexico, but they're there at lower levels. I'm looking at numbers, especially in Doña County and in Bernalillo, that are still pretty high. I saw San Juan looks a little bit high also. So we still have some relatively concerning spots in New Mexico, and nobody's red, no counties are red right now, but we still have some yellow spots that, there's enough cases. So we still have a good bit of transmission going on in some places. In Santa Fe, we've been pretty good. We've been mostly under 10 for the last almost couple of weeks now with our daily case rate. So that's great. So I would say that that is a great reason to get vaccinated, because when we get to this point of herd immunity, the way that the variants arise, or that more variants arise, every time the virus gets passed from one person to another, it's an opportunity to mutate. It's just the longer the virus lives and the more the virus replicates, the more mutations happen. And so when we give the virus an opportunity to be transmitted and to replicate, we're giving it an opportunity to mutate. And so if we get vaccinated, we're cutting that opportunity off to mutate. And, as long as there are places in the country, even, Michigan's still pretty concerning. Some places on the East Coast are still pretty concerning, where the virus is replicating a lot. We're not out of the woods. Even in New Mexico, may seem kind of far away from Michigan, But as you said, people are traveling here from everywhere. People are getting on planes again. So it's not that far. Every place is close, really every place in the world. So we still, really have to push. We've got over 50% of our population vaccinated. We got to get the last, a little bit less than 50% or close to that. And then I think that we can, enjoy our summer with ease and not have to always be looking over our shoulder and worrying about COVID.
Thank you. Any last things on your radar screen? I'm always worried about 87505, 87507 and equity and reaching those folks who are still essential workers. They're stocking the supermarket shelves. They're doing the checkouts. They're doing the working in our restaurants and so on. We got to reach them. We got to make sure they can get what they need. Some of them are speaking Spanish. Maybe the English language information is a barrier. We need to make sure we're speaking Spanish, distributing information in languages where people can get what they need to know so they can get the vaccination. We have vaccine. We just got to get it into people's arms.
Yeah, I mean, we are partnering with Santa Fe Dreamers, I know, and trying to do some outreach. Somos en Pueblo Unido has been doing a lot of great outreach and distributing a lot of really good information to that population. Just among my patients, I often find that people don't really realize sometimes when they're those essential workers how high their risk really is. And so I think that's an important part of it, to get people to realize that the risk is really high. They need to kind of, again, sign up to the Department of Health website. If you're a patient of Christus, or if you're a patient of any primary care, really, to ask your primary care doctor as well, because more and more primary care sites or other clinics, Presbyterian Hospital, Christus, I know, is doing a big push. I think you can call Christus directly. Also, I think they're doing over 50 patients who are over 50 who, even if you don't have I think it's over 50 with a chronic disease and maybe over 60 even if you don't have a chronic disease. But go to the Christus website, give them a call, and they'll let you know how to get connected that way too.
I did hear a story, and I'll end with this. I heard a story yesterday about a supermarket worker who was working the checkout lane, and one of our friends went through and asked the woman behind the checkout, have you been vaccinated? She said, no, I'm waiting. I'm still waiting to be told that it's my turn. And he said, well, have you registered? And she said, no. Well, you're not going to get a notice to come if you're not registered.
Right.
You've got to register. The state, someday we may reach the point where we have so many vaccination opportunities that it'll just be like open drive-through. You don't need an appointment. But we're still right now doing it by register, get a code, show up, get vaccinated. But if you want to get vaccinated, the first step is that registration. And you're right, Wendy, you can call Christus on the phone. They'll help you do it. Our seniors division in our community services operation will help you do it. The Fiesta Council has done outreach to help people do it. So there's a lot of help, but getting registered is the first step.
Right. And you can call if you don't have access to a computer and you don't know how to access any of those places. You can call the Department of Health as well. And maybe we can put that phone number on the Facebook Live later. But you can call Department of Health and they will get you registered. They will walk you through it and sign you up for you. And they can just call you back when your time is, or give you a text even, so you don't have to have a computer or even a smartphone to be able to register. So that's all great.
All right, doctor. Nice to see you.
We'll see you next week. Nice to talk to you, Santa Fe. Mayor Webber.
Enjoy. All right. Well, that is such good information, and she's right. If you have questions, talk to your primary doc. Call Christus or call Prez or La Familia and ask for information. There's a lot on the DOH website. We're making progress. We are leading the nation. There was a big story in the New York Times that New Mexico is leading the country. We're number one when it comes to vaccination, and a lot of the credit, the serious amount of praise goes directly to our governor and her team for just being like laser focused on doing the right thing. There are other relationships involved with COVID, and one of them has to do with economics. And our friend Gary Lutz just sent over a big sheaf of paper about COVID related SBA lending. So if any of you are wondering about opportunities to get Small Business Administration loans, there are express loans up to $1 million through September 30th. It's amazing the amount of opportunities. In some cases, there are no guarantee fees or annual fees. There's a restaurant revitalization fund that's available. Applications are not quite yet ready, but they will be coming. There is another grant for shuttered venue operators, things like our movie theaters and the opera and other shuttered venues that had to close down because of COVID. There's a grant available for that. All of this is coming. And so if you're interested, there is a lot of information through the SBA, Small Business Administration. Go to sba.gov, coronavirus relief, and you will get a whole sheaf of information about ways that as we come out of this lockdown period of quarantine, now we're opening up. You're a business, you're a small business, you're a mom and pop shop, you need help. The Small Business Administration can help you. Go talk to the folks at Century Bank, get help, get money, get well financially. More things going on. Today is Earth Day. Happy birthday, planet Earth. We love you. There is no planet B. We all know that. And we are very focused on climate change and keeping Santa Fe beautiful. In that respect, tomorrow, Saturday, April 17, 9 to 12, is the Great American Cleanup. KeepSantaFeBeautiful.org events. You can clean up your own neighborhood. You can clean up somebody else's neighborhood. Counselor Abeda and I at 9 a.m. or soon thereafter will be on Airport Road picking up litter. We have challenged the other members of the governing body to a litter pickup competition, see who bags the most. And if you want to pick up litter in your neighborhood, in your part of town, or in somebody else's, tomorrow, part of the Earth Day celebration, Keep Santa Fe Beautiful. It is a community event. We all love this city. We all care about its attractiveness. As we reopen, we're sprucing up Santa Fe. We're cutting the weeds down. We're cleaning up the medians. We're taking care of the parks. And here's a way to pick up litter in your own neighborhood. We are also trying to win the Mayor's Challenge for Water Conservation. In it to win it. If you pledge at mywaterpledge.com, that you will reduce your water use. And we finished first in the nation in our size category. Some lucky community charity will win a 2021 Toyota Highlander hybrid vehicle. So, and even if we don't win, the more water we save, the better we are. We know we're in a drought situation. It's tough. Fortunately, our water utility has been planning for this and dealing with it for years. We've got a lot of plans in place to make sure that our water supply is not threatened, but we don't want to waste water. We don't want to use it randomly. We want to be very careful. We also want to take steps toward preventing a forest fire. If you're worried about forest fires in your neighborhood, doesn't have to be up in the national park. You can go into the national forest. Forest fires can start anywhere. And if you're worried about your home or your neighbors, your neighborhood, our Santa Fe Fire Department will schedule a free consultation to come talk to you about how to safeguard your home and your neighborhood to prevent forest fires from coming in and sweeping away across our town. There's some more good news. I'm just going to tell you some more good stuff. Zozobra. Zozobra is going to happen. We're all excited. It will probably be a hybrid of some kind. Last year that was virtual, and they set attendance records with people from all over the country exploring and getting excited about Zozobra. Right now, the official Zozobra poster and the official Zozobra t-shirt competition is going on. It'll go on through April 30th. You can go to you can go to art@burnzozobra.com and find out some more about how to get your drawing, your submittal to be the t-shirt or the poster. Movies are back. We just saw our friend Mario Lopez in town. Now there is another film coming to Santa Fe. The same folks that made the movie that he was starring in are going to have just gotten a green light to do a Lifetime murder, drama, true crime show in June in Santa Fe. The true story didn't happen here. It happened in Utah, but they'd much rather film here than in Utah. Who wouldn't? And so they'll be back. That's more business for us. That's more. Santa Fe gets to always look good and be the star of the show. Whenever there's a movie made in Santa Fe, the show is the show, but the real star is Santa Fe, and we know it. Shop local, a reminder, SantaFeMarketplace.com. Please register to get vaccinated at vaccinenm.org. Vital Spaces this Saturday, 11 to 3. We'll be giving the community art closet, opening up again, free art supplies for everyone of every age group and every skill. It's at the Southwest Annex on the Midtown campus, 1600 St. Mike's Drive, free art supplies. It's every third Saturday of the month, 11 to 3. Coming attractions, the Mayor's Virtual Give Back Ball will be April 22nd. It's virtual, but it's the Give Back Ball back again. We had to call it off last year because of COVID. The year before that, it was a party in the convention center with pink flamingos and dancing, and 250 of our finest community volunteers being recognized for the beautiful work they do for Santa Fe. Here it's virtual, but still recognition of our volunteers. The city wouldn't run without you volunteers, and we love you and we appreciate you, and the Give Back Ball is in your honor. If you're interested in economic development news, the City of Santa Fe Economic Development newsletter is posted, santafenm.gov. Click on the different departments on that website. Go to economic development. You'll see all the cool things going on, courtesy of the Economic Development Department and our friends and our partners. We're in budget time with the city right now. If you're interested, tune in and watch and listen as our finance committee and governing body members evaluate the budget submittals. There's a 4% salary increase for our well-deserved members of the Santa Fe city government team. In addition, the city will be picking up the $2.3 million increase in healthcare benefits. We don't want them to get, as we come out of COVID, we don't want our employees to have to pay more for their health care. So we're picking up that expense with the 4% increase in salary. On top of that, there's some very important new initiatives in this budget, including a citywide growth management study that is absolutely essential for our future, so that as we put more housing together with more economic development, with more investment in entrepreneurship and startups, we need to safeguard our water, our air, our night skies. Our traffic problems need to be fixed. Our roads need to be improved. So a citywide growth management study is critically important. That's in the budget, along with filling a lot of empty positions. As our economy comes back, we will be returning city government services to what you need, you want, you expect, and you deserve. That's about it for today. It's great to be with you. I hope you have a beautiful, healthy, safe weekend. Remember, when you go out, still wear your face mask. Be a good example, role model, set a good example. Keep Santa Fe safe, keep yourself safe, get vaccinated, keep your family healthy. Let's keep our city healthy. We'll all take care of each other, and we will see you next week after a beautiful weekend right here in beautiful Santa Fe. Take care. I'll see you next week.